welcome to this week's episode of Fillyourcup. This is an integrated space, and we love to magnify some amazing, health experts from around the world. And today we've got the beautiful Kristen Brown, all the way from Washington. Hi, Kristen.
Hi.
So just to give you a quick rundown of who this amazing lady is. So her background is as a nurse practitioner, but she's also a mum of two and a wife to her partner in crime. The other key things is she loves yoga and is a sometimes runner. I think she put it, a fair weather friend is how you described it. But also she, from doing the functional medicine after being a nurse practitioner, she then went on to found Altheta Health, which is the website we got in the background. And she came to do this because she wanted to find a way or create a micro practice to treat chronic and complex medical problems. And she's got an amazing approach to functional medicine and to health and to self-care. So I'd love to introduce you to Kristen, and welcome.
Hi, thank you so much, Ray, for having me. I've been looking forward to this, and I'm so excited to share on your platform, and I just love what you guys represent as well. So I think it's a great mix. Thanks for having me.
That's awesome. And so maybe let's get started so that the people that are listening or watching can get a real feel for who you are. Do you want to tell me, I'll share a little bit about your story and how you went through this thing of becoming a nurse practitioner and what led you there, and then functional medicine and to what you're doing now?
Good. Yeah, I'm happy to do that. So a little bit about my story. So I grew up in a family where there was heart disease and diabetes and hypertension, and my grandma now is living at 93, almost 94, but she's got diabetes and glaucoma and macular degeneration, and her spirit is there 100%, but I see her body failing her. I grew up with a dad who smoked and drank and didn't take care of himself. He wasn't in my life much when I was growing up, but as I became an adult and started having kids, he was involved in my life and my family's life a little bit more. I got my first degree, bachelor's degree in biology, and wasn't exactly sure what I was going to do with that. I worked as a microbiologist for a little bit and had enough of petri dishes and E. coli and all that stuff and salmonella. And
Yeah.
It was good. I like to work with people and not bacteria, so that was good. And then I started researching more, and I knew that I wanted to be in the medical field somewhere. Just love that approach. I wanted to be able to feel empowered to help people, my loved ones as well. And so funny way, I decided I wanted to be a nurse practitioner, and I had to go back to school to get a nursing degree. I know it's a little bit different in Australia. So I went back to school and got a nursing degree. And then I worked as a nurse for about 5 years and got into graduate school. A master's degree is what a nurse practitioner is here. And studied in Seattle, which is what brought me to Washington, and got my master's degree as a family nurse practitioner.
Okay.
So I'll tell you what got me into functional medicine, though. So for years since I've been a family nurse practitioner, I have been in family practice and urgent care. I love the urgent care. I still do. I believe that, there's definitely urgent needs for Western medicine. There's always a place for Western medicine. And the family practice part is kind of what really led me to functional medicine, because I'd get these patients in my office that I had scheduled maybe 20 minutes, but I was already running an hour and a half behind, because nobody just comes in for 20 minutes.
Yeah.
And I would just be able to put out their fires, like, okay, they've got anxiety and they've got hypertension today, and I know that they have these other things, but I've got to put out the fires because I only have a few minutes. And the way I was, we're kind of trained is find their symptoms, what matches it, how those match a diagnosis, and what can we do to tamper down those symptoms. I get so frustrated because people would come in with multiple diagnoses, with just wanting to know what to do, and I just didn't feel like I had the resources or the time or the training to really help them get better, just to help them better till I saw them again maybe, but really not the way I wanted to. But I didn't know where to go. And I also would get frustrated for patients that I would see that maybe didn't really want to change their diet or lifestyle and wanted more of their cholesterol medication. And we all know what those do. And I didn't even realize as much then what I know about how all these medications do and what the other things they affect besides just, for example, cholesterol. Yeah. And so that's where I was. And my family decided to take a little sabbatical to Costa Rica. My kids were 6 months and 2 years old, and we packed 2 suitcases. My husband's a musician. We packed his music gear and our kids in little backpacks, and we headed off to Central America. And it was awesome. And we walked everywhere.
Yeah.
Produce was readily available. It was sunny. We ran because I'm a fair weather runner in Costa Rica. And it was just really, really good for us. We came back and we went to where I grew up and saw my family for a little bit, and then came back to Washington and headed back there for Christmas. So almost exactly, I don't know how many years ago, but my father passed away unexpectedly on Christmas Eve, and I hadn't even seen him yet since we had just gotten in town. And so that really made me think, like, I was a 40-mile-a-week runner. I was a vegan at the time, and I was just like feeling I had all these things that I thought I should be doing. And I knew that I had had high cholesterol in the past. I'm like, my dad died of this massive heart attack. He had high blood pressure. He didn't take care of himself. And so I'm like, I got to figure out what's going on. So I researched because I was just like, I don't want this. I've got little kids. I want to be around.
Yeah.
And I found functional medicine. So I found a functional medicine provider. I saw her for a while, and she kept asking me to come join her practice. And I'm like, I'm pretty happy with where I'm at now, but I just knew there was something calling me. And so I decided to study functional medicine. So I started studying with the Institute for Functional Medicine, did their entire course and passed my boards. And I love it because I love that I get to have the time. Now that I have my own practice, I get to spend 90 minutes with my new patients.
Yeah, wow.
I
So
get to spend
from 20 minutes to 90 minutes now.
Yeah. And I get to decide how long we need to see, and I don't just say, here's your lab results, this is what you need to do. I say, come and talk to me. I also have a telemedicine practice, which is helpful for my patients who don't live in Washington. But like, I want to teach you because you're the one doing the hard things when you're not here. Like, I don't want you just to do it because I say. I want you to know why, and I want to teach you to listen to your body. And so I think I found it because of my dad, but it's changed my life, and I'm hoping I'm helped change the life of lots of other people too. So
just to recap that, so basically you did what everyone does, and they go and get a bachelor's degree in something, right? Something where they're not necessarily sure what it is, but they know for some reason they're interested in this, and maybe their parents have said it's a good idea, so we go and do it, right? Or we get a trade. So you fell into biology, and then what was the thing that drew you towards nursing? Was it that you enjoyed helping people, or the care? Like what? Because nurses are a specific group of individuals, and they're just you got to have a pretty big heart to be a
different
nurse.
breed, huh?
Yeah, resilient and tough as well.
So one of the things I liked about being a nurse practitioner, so I had a biology degree, so that meant I could take the test to apply to medical school. I could try to become a physician assistant. I could be a nurse practitioner or be a nurse. And I loved the experiences I've had and I heard others having with nurse practitioners where you feel listened to. You feel like they're spending so much time with you. And really we're not. You just feel like it because we listen. And I wanted to be a nurse in the hospital. My first job as a nurse was in hospice. And that was an amazing job for me because I realized at a young age and early in my career that what matters in your life at the very end is your relationship with other people and your relationship with a higher power, no matter what you call that power. I mean, I took care of drug addicts. I took care of retired physicians. I took care of, leaders in their community, but it was all the same. And that was awesome for me. So I love that I had worked in the hospital too after that, just to get varied experience to help me for nurse practitioner. And I just knew that I wanted to approach my patients as a nurse. And that was my route. It doesn't have to be the route for everybody, but
absolutely.
It was like, this is what I feel is I need to be doing. And I felt really blessed to have scholarships and a supportive family. And I grew up with a single mom. And we were on welfare a lot of my life. And so I feel like education is what has helped me get to where I am and to be able to stand up for myself and say, I want to do this. Can you help me?
Yeah.
That's pretty lucky. Pretty lucky.
Yeah. And it's amazing, right? Because you got to the point where from that background, it drove you into this specific niche, which was nursing. And then it sounds like, seeing, obviously working in hospice, you saw people at the end stage of life. And straight away that reminds me of that, the 5 regrets of the dying, and like you said, you really, the things that really matter are our connection with the people we value most and also that connection with whatever the higher power or the higher purpose is, right? And I find that quite profound. And then also seeing your father and, his impending mortality and seeing the lack of self-care that he potentially had.
Right.
And then using that as a point of inspiration to then create a change. I find that really powerful because, the majority of society seems to wait till they're desperate to make a change. But you could sort of, through, and your dad might have just not known any better in the same way I know with my dad. He didn't, right? And I wish he had the same level of support and knowledge that we have now. But, I think to make a change out of inspiration to functional medicine and then use that with your patients, is that sort of the pathway that, you found yourself on?
Yeah, I think so. And I think that becoming a nurse practitioner after I became a nurse was important to me too, because in nurse practitioner, I have very similar privileges to a family practice physician here in Washington State. So I can prescribe, I can diagnose, I feel like I would feel more empowered to help my patients. I felt like my skill set was bigger, my scope of practice would be where I needed it to be to provide the level of care. Yeah. And also I felt like the people that I was talking about in my family practice model were the people I was scared of are exactly the people I feel like so empowered to help now. Like they come into me with this huge history and all this stuff, and I'm not as scared anymore because I have the tools and the time, and they're more committed too. So
and do you find now with the functional medicine approach that you've got this community that you can sort of cross-refer to and really work with?
Absolutely. Yeah, I definitely can't do it by myself. During the intake that they fill out takes about an hour and a half before they even come to see me. Oh, wow. A lot of questions I ask them, they're probably like, why? And then they're like, well, why has nobody asked me this before? But we talk about nutrition in the intake before even seeing me. Talk about have they had trauma? What's the relationship with food? How many antibiotics have they had? What was the situation when their mom was pregnant with them? So, wow. I already know even before I meet them, like, okay, they need to see a nutritionist. They probably need a therapist because everybody needs a therapist at least once in their life.
Yeah.
And creating this big team that can come at it from lots of different areas. And in functional medicine, I'm not just thinking about their lungs or their skin or their digestion. You have to know that your stress involves your hormone, can influence your hormones, can influence your reproduction, can influence your sleep. So it's totally all tied. And I feel like a team approach and having people I can trust with patients, and they also refer back to me because we all need to know what we can do and where we need to ask for help.
So powerful, and I think it's something with the medical system that is so needed. And I know in hospitals we do our best, to work together as a team, but it's still within an acute and chronic setting, and it's very hard to change it. But when you've got these self-empowered, micro practices, and people who are as passionate as yourself, who are straight away getting this massive history, and you might even find it right where you get to their first session, you're like, actually, who you need to see next. Like giving them just enough information. It might not be you, right? And that seems counterintuitive because, especially when I was brought up in practice, it was like, you've got to get the clients back because, you got to get this client care, and that's how you're going to make the change. And realistically, it was just about making money, right? And making a successful business. And that was something that very much turned me off, the allied practice that I'd sort of grown up in. But what you're sharing with me is something so much more beautiful. And I think for a lot of people listening, I think that's how they hoped healthcare should be.
Right. It should be. And I feel like with you, Rory, I feel like patients come to me and say they have a huge issue with food. And when we're using food as medicine, you have a poor relationship with food, you're not going to do well on an elimination diet or a yeast protocol. And so I let them, know where I think that we need to go next and get their feedback and say, okay, if you need to stop with me and go to a therapist and work most slowly with me, I'm hoping and trusting that they'll trust me and they'll want to come back.
Yeah.
And I'm okay to, meet them where they're at and encourage them a bit out of their comfort zone, but not so much that they think they're going to be a failure because it's just feedback. If you do or don't do, it's just feedback.
Yeah, and that's powerful as well. I think that key point you mentioned, it was this two-way conversation, right? Whereas I think for a lot of people, they might feel that when they go to see a health practitioner, it might just be a one-way conversation or one-way approach, right? So and what you're sort of saying is you get feedback and then you give them direction and recommendations, and then they get to sort of step outside their comfort zone relative to what they feel they've got the trust and rapport to do. But they know they get to hold your hand for as long as they need.
Right. And I let them know, everyone know that I'm pretty good at reading people, but if you feel like I'm pushing you too hard or that you feel like I'm going to judge you because of what you do, that's not the way I want my relationship to be. So please let me know. Please talk to me. So that's very important.
So that's powerful, and I think it's such a beautiful approach, Kristen. And we've got your website in the background, but what I want to know now is, coming into this present time, Kristen goes to work tomorrow. Kristen wakes up tomorrow. Why do you get out of bed in the morning each day to go and do what you do now?
That's a great question, and it's also pretty awesome to think about. So I've been working really hard the last couple of years, especially the last year, to really create the life I want to live and do the things that fulfill me and help others, and figure out how to make that my career. And I really feel really lucky that I get to optimize my life. I get to spend time with my family. I get to learn things at work that are going to, spill over into my family life. And I just love it. I never have studied so much in my whole life in any career. I feel like with holistic medicine, you've got to take things from all over, and I'm constantly learning new things, and hopefully it'll keep me away from dementia at a young age. But I feel like I'm using my brain so much, and like we've talked about, I just feel like I've just had so many events in my life that have led me here. So one more thing actually I wanted to add. I actually was thinking about this before. I've been thinking a lot. I don't know how much you know about Washington weather, but we have about 8 or 9 months of rain, and sometimes when it's not raining, there's still clouds, actually most of the time. So if we contrast that with my experience in Costa Rica, where we could walk or run everywhere and produce was just available, right now there's pretty much every day I think about, okay, why don't we do that some more? But I also realize that for my family and for me, like I'm happy here, and even though I don't like the weather, but I feel like, okay, I'm going to really work on blooming where I'm planted. Yes. Because if I'm always waiting for the next best thing, I'm never going to be present. And I would say that's one of the best things I can help my patients learn and realize, that am I present or am I not present, and what do I need to do to get there? So that's what gets me out of bed. I feel really, really lucky, and functional medicine applies to everybody. So.
And I love how you said, as a health professional, as allied, health practitioner, you said one of the first things you actually talked about was self-care, and this self-preservation and this family and what that means. And I think that's so beautiful, because, as an example now, we've got and I was one of them, an allied health professional who lost his health, so
right.
And we can't be part of the problem and the solution at the same time. So I think that approach is quite beautiful. And then you talked about, when you really blossom from where you've been planted, then you get to sort of, fill over or overflow into the people around you, which, is your patients, your family, your friends, and that's where you can have a really amazing impact. So I find that great, Kristen. So thanks for sharing that.
Yeah, thank you.
And coming to that point of self-care, like you have a lot of clients come through your clinic or your micro practice, and what I want to gauge is there are probably some common tools or some common things that you could share with the everyday person so that they could promote a bit of self-care in their life. Right. If you could name one or two things from your experience, what would you recommend to anyone that's watching or listening?
Sure. So one of the things that I recommend is daily meditation. It can take whatever form you want. So for some it's yoga, prayer, meditation, exercise, or a combination of all of those. In my new patient visit summary I send them, there's a link to breathing. So Dr. Andrew Weil here in the United States has a great video on Vimeo, and it's about 4-7-8 breathing. So I teach everyone that, even when I give wellness talks or seminars, I try to have the audience do that with me. Another thing is daily laughing. I think it's really important to smile. I've started asking my patients to do that in the morning and at night, so I think that's really good. And then helping them focus and learn to listen to their body, because our body's trying to trust us, we're trying to trust it. And the feedback that we get from that experiment is a great place to start, right? Improving communication with our bodies and with people around us is so healthy, and it does so much more than I can do with a prescription or a supplement.
So basically, meditation, listening to your body, and some effective breathing techniques, right?
Yeah. How many times when you're anxious and angry do you find that you're not breathing and you have to go, because you got to do it. It's lots of good impact from that.
Yeah, I find that quite beautiful. And also the fact that you talked about meditation isn't just meditation. It could be like
Right.
you don't just have to get an app. You could it could be prayer. Some cultures, they pray 3 to 4 times a day. So all those points are these points of stillness and meditation where you really get to connect, not just with your mind, but your heart, and be present, and also connect to higher power. And also you mentioned exercise, and I think that's something that really resonates with me. And even my girlfriend's dad, we were out surfing the other day, and he had quite a stressful week, and I just had a chat with him. I was like, do you feel more relaxed now that you're out here? And dolphins are sort of swimming past us, and he's catching a wave and getting in the flow, riding his big mouth. And he paddled back out, and he's like, yeah, this is my meditation. And I sort of sat there and I was like, it's so true, right? It can be, say for my girlfriend's mum, it's going for a walk with a dog and walking up through nature and just connecting in. Like, that's her meditation. And because I used to be like, to everyone, I'm like, do this meditation tape, and they're like, here's the next best thing. But it could be something as simple as that.
Mm-hmm. Yeah, I totally agree. And I have many different approaches that I try, just depending on what I'm going through. So what I need to connect to at that time.
Yeah, that's wicked. And okay, just the last thing before we round up for today, and thanks so much for taking the time to be vulnerable enough to share your story. And I'm sure there's a lot of nurse practitioners and just women out there, and even blokes that are they've been waiting to hear this message. And also there's some key pieces of information, I think, in terms of your journey where other allied health professionals might see where they can sort of go and look into functional medicine and like that too. So if you had one message, knowing all of what you know now, and you had to share that, with your future self or, with future generations, what would that one message be?
I love this question. So I've thought about it, and here's what I would say. If you know better, do better. Or when you know better, do better. And if you don't do better, ask yourself why.
Ooh. That's very deep and profound.
Thanks.
All right. On that note, we're gonna finish with that. I think people might have to rewind and go through that again. But that's amazing. So thank you so much. Thank you so much for your time, Kristen. And
thank you, Rory.
I look forward to following your journey as well. And please keep in touch and make sure that we keep this integrated, this collaborative community going, because I think we're going to do some pretty amazing things in this world.
I think so. There's a lot of us trying to get doing what we're doing, and thank you so much for supporting it, Rory. It's awesome.
Likewise.
Okay.
All right. See you next time.
Thank you.